The healthcare system in the U.S. is failing, according to a brand new report comparing American healthcare to 9 other developed countries. According to new data, people in this country die the youngest.
You have your top tier, the top 3 countries, Australia, Netherlands, and the UK. And then you have the 6 remaining. What? 3 plus 6, there are 9. Yes, the US is way down there. Welcome back to my channel. I'm Dr. Duncan, Dr. D, and today we are reviewing this article. I was browsing the groups that I'm part of on Facebook, and I came across this comment from Big Willie's group, so I had to check the video.
The healthcare system in the U.S. is failing, according to a brand new report comparing American healthcare to 9 other developed countries. According to new data, people in this country die the youngest and experience the most avoidable deaths, even though we spend nearly twice as much on healthcare. Joining me now, former White House Health Policy Director under President Obama and MSNBC medical contributor, Dr. Kavita Patel. I found these results shocking that even researchers say the U.S. stands out for its exceptionally weak performance. Are you surprised? And if not, how does it manifest itself for your patients?
Yeah, Chris, I'm not surprised, sadly. This is a study that the Commonwealth Fund has been doing over the years, and they compare health system performance across 10 countries, including the United States. And they compare them to kind of like countries, you know, Australia, Netherlands, United Kingdom, France. And when they looked at all of these countries across 5 areas, access to care, care process, administrative efficiency, equity, health outcomes, Chris, it's no surprise that we're ranking very low, if not the lowest in overall performance. It manifests every day with patients, access to care. Chris, think about how long it takes to get an appointment. Think how long it takes to get in to see a specialist. Add to that if you're on Medicaid. I'll even make it easier. What if you're in Texas? They didn't expand Medicaid. Or Florida, states where they have not expanded access, where we have the ability to do it today. That's why we're seeing these results.
Yeah, just try to get in to get an MRI or a mammogram or,
right.
6 months.
Yes.
Anyway, the report says that the U.S. Has the lowest life expectancy and the highest rate of preventable and treatable excess deaths.
So once I started watching this video, I said, I have to get to the source to see this study. And that's when I found the article, Mirror 2024, a portrait of failing U.S. health system. Yes, this article is from the Commonwealth Fund, came out in September of this year. It compares the U.S. healthcare system with 9 other countries, 9 other healthcare systems that are similar. Yes, this is nothing new. They have been doing this list since 2004, if I'm not mistaken. The goal of the study is to compare health systems performance in 10 countries, including the United States. The method is analysis of 70 health system performance measures in 5 areas: access to care, care process, administrative efficiency, equity, and health outcomes. So they concluded on this study that the U.S. continues to be in a class by itself in the underperformance of its healthcare sector. While the other 9 countries differ in the details of their systems and in their performance and domains, unlike the U.S., they all found a way to meet their residents' most basic healthcare needs, including universal coverage. So in this edition, the 10 countries that were compared was Australia, Canada, France, Germany, Netherlands, New Zealand, Sweden, Switzerland, the United Kingdom, and the United States. So the 5 key domains of health system that would examine for performance was access to care, care process, administrative efficiency, equity, and health outcomes. So despite their overall rankings, each country, there was no one country that came out top in everything. Each one had high and lows, certain flaws, but it was evident. It came out very evident that the United States was weak in most of the categories, and compared to the rest of the 9 countries, there was a substantial difference, especially when you think that they spend a lot more than any other country in healthcare. So what happened? What's going on? So here you can see the healthcare system performance ranking. You can see the countries, the overall ranking, and how they ranked on each category. So here you can see that they are fairly similar between the first and the 9th place. There's a difference. You have your top tier, the top 3 countries, Australia, Netherlands, and the UK. And then you have the 6 remaining. What? 3 plus 6, there are 9. Yes, the US is way down there, in spite spending way more on healthcare. So this is like, where is the failure? Because it's good to spend as much as possible in healthcare, as long as you are giving the people great healthcare, because that is the objective. But when you spend that much and you stay that far behind, then there's clearly something that is not connecting. So where is the problem? Because this is your healthcare system performance compared to spending. If you can see, what is Australia and Netherlands are better than all the remaining countries on regards of the amount that they spend on healthcare versus the quality of the service. Versus the US, that spends way more in healthcare and the quality is just not there. And this is the performance in each domain and how they ranked. So let's start with access to care. So access to care focus on the affordability and availability of the health services at the population level. So the ones that performed the best in this category was Netherlands, United Kingdom, and Germany. The one that performed the worst was the US. So let's see what is the difference between these countries and the US. So Netherlands, United Kingdom, and Germany excels in measures of affordability because of each country has low cost related barriers to care, as reported by patients, and minimal out-of-pocket health care expenses. Like, for example, in the Netherlands, visits to primary care, maternity care, and health care providers are fully covered. In the UK, the National Health Service provides free public health care, including hospital, physicians, and mental care health. In the US, the lack of affordability is the problem. With a fragmented insurance system, a near majority of Americans receive their health coverage through their employer. We're talking that roughly there are 26 million Americans uninsured, having to pay out of pocket. That's not even a possibility for most uninsured Americans. And the ones that are insured, depending on their plans, the copay is almost sinful. And what this causes, you see a lot of people just skipping their medical tests, their treatments, their follow-up visits, even taking the medication in odd days just to make it last longer. And in regards of availability, most US patients will report that they don't have a regular doctor based on the shortage of primary care physicians. But it's not all bad. Not all bad, right? Let's just go to the next category, which is care process. Care process looks at whether the care that is delivered includes features and attributes that most experts around the world consider to be essential to the high quality of care. In this area, the US came out in second place. This here, we are talking about prevention, safety, like coordination and engagement with the patients, like making sure that they have their mammograms, that they have their flu vaccines, and emphasizing the safety on this regard. So this has represented significant reduction in adverse effects on hospitalizations, well, at least in paper, on events like heart attack, pneumonia, on major surgeries. So it's not looking all that bad. US was last in the first one, second in the second category, the third one being administrative efficiency. And this one focuses on the measures of the challenge doctors have in dealing with insurances and or in medical claims issues, and patients' time spent resolving medical bills, disputes, and completing paperwork. So on this category, again, number 10 out of 10. So I can see here where the problem is. We are strong in prevention, and then we have a bottleneck in administrative efficiency. So everything is placed in check to help patients and do their screens and preventions and all that. So the patients are great. You have all the information, but when it comes to administrative efficiency, where you have to, fill out the claim, so this can be processed, so this can be done. Then you have the famous pre-approve, which even doctors have issues with. We send a medication and then the insurance company says no, we have to pre-approve it first. A study that is necessary, that has been set by the administration. We have the plans, we have everything set in motion with the care process. But when it comes to the administrative, with the approval, then there is the bottleneck, there is a problem. We have to pre-approve it. The insurance have to make sure it's valid. And then you have all this type of different coverages that are ever changing. And today you have a coverage, the care process is there, and when you're gonna make it in effect, take it to the administrative efficiency, then we have to pre-approve it, and then, oh no, today is not valid anymore. You're paying for it. You're hardly paying for it. You're making ends meet to pay for your insurance, and insurance that is supposed to be there to protect you when you need it, and all of a sudden when you need it, then the insurance company says hey, we have to pre-approve it. And sometimes your coverage changed and it's not covered anymore. Or yes, it's pre-approved, and after the process is done, 3-4 months later, then you can do it. When whatever was the issue, now it's a bigger issue, and now it's a different thing, and now we have to do more tests, then they have to, again, pre-approve. But I'm ranting. Let's get back to the study. Again, high performance, like Australia and the UK, they excel in administrative efficiency by minimizing the payment and billing burdens. They are less process, more efficient. Let's just take care of this so the doctors can continue doing their work, so the healthcare system can continue being flawless. So we know what the top tier countries are doing, and we know why the US, which is last, what they are doing. So this is the thing, learn from the data that is collected and just improve. So now we're going to equity. Equity domain reflects on how people with below average and above average income differ in the access to healthcare and their healthcare experience. With this category, we also analyze, besides the income, race, gender, and where do they live geographically. Here, top tiers, Switzerland, UK, the Netherlands. 10th, US. Okay. I made a video about medical gaslighting, and I'm mentioning this because in this section it analyzes gender, which unfortunately in some countries that is an issue. How doctors refer to a man who is in pain versus a woman, a man who is stressed versus a woman. And obviously race is a big issue in the US. So all that influenced the result. Needless to say, why the US came out last in this category. Unfortunately. Unfortunately, not just for the US, that in any country this still exists in some shape or measure. That people would prefer to stay home or deal with their pain or problems at home in fear to be exposed or ridiculed or ashamed for a condition that they suffered. We have to do better around the world. Last category, health outcomes. And in this one, this is basically the outcome most likely to be from a health care intervention. And to find the US last again on this category was shocking. It was really shocking until I realized that COVID was a big part of the result. How all that COVID crisis was managed, how that situation was managed, definitely affected the numbers and made the US the last one out of these 10 countries. It was just horrible. That common sense during those years of COVID wasn't in the best interest of people that are well known. People that have the fate of the health of a nation in their hands and decided to do what was in their best interest. Not in the best interest of the patients, but in the best interest of their pockets. Unfortunately, it was a shame. This can never be repeated. The knowledge is out there. We cannot be victims to blatant malpractice, and that no one is in jail. It's shocking. It's more shocking than see the results. But yes, out of those 5 categories, that was the study. That's what was concluded, how the US came out 10 out of 10, spending a lot more than all of those countries. So what can we do? The doctor in this section, she explains, she hits the nail on the head.
The report says that the U.S. has the lowest life expectancy and the highest rate of preventable and treatable excess deaths. What are we doing wrong? Can we reverse this trend?
Yeah, I think we need to move from like I say this and I take a lot of humility, Chris, because I'm part of the problem. We have a sickness system, right? As doctors and professionals, we respond to sickness. You go to the hospital, you go to a doctor when you don't feel good. Chris, what if we inverted that pyramid? What if we paid health coaches, primary care doctors, pediatricians, people on the front lines? What if we paid them the most? This is sometimes what we see in other countries to prevent illness. And it's just something that we're starting to get a little bit better about prevention, but none of us want to be sick. All of us want to live longer. I want to be active to see my kids grow up, have their own kids. So why don't we start paying for those outcomes? And I think because of the way the insurance system is designed and the fact that we're still tied to kind of year to year, you might change your plan next year. So that plan doesn't know that you want to work on prevention and that we have such a distance between our providers and our patients. So there's a gap between us, sometimes a physical screen between us. We don't even get to look patients in the eyes. We need to change that equation, and we have the power to do so. I love election years for this because this is a top voter issue. I'm hoping both candidates, Trump and Harris, get to talk about what they're going to do to reverse these trends.
It's all about changing the focus. If we are focusing on the sickness, on reacting to the disease, and then we're spending a lot of money taking care of the people that are in the hospital and taking care of the people that are already in dire conditions and helping them live as long as possible with the worst quality of life. Instead of focusing on preventive medicine, what are we doing? We spent that money on preventing the disease and keeping the population as healthy as possible, even though it's not in the best interest of the pharmaceutical companies and the insurance companies. Then we'll be at the level or surpass those countries that are spending way less money than the US is spending. Because we will be allocating those funds into the right hands, giving doctors bonuses instead of prescribing medications on keeping their patients as healthy as they can be. Talking about wellness, about a healthy lifestyle, about eating habits, exercise, sleeping, stress management, water intake, things of that sort that we know it prolongs the life. It helps with the quality of life and keep people out of the hospital. So we could spend way less and help way more. It's all about prevention. It's all about changing the focus. Taking care of the ones that are sick, attending to their chronic illnesses, honoring what we offer with insurances. If America want to be great again, the health system has to change. The population has to be healthy, has to be happy, as stress less as possible, and nothing, not even money, stress as much as your health. And we know that. What are we doing? We have to focus on prevention. That's why we're going to continue our topics regarding prevention, regarding about wellness and nutrition, things that we can do naturally to keep us healthy, and continue to review articles like those. And if you have any comments, anything that you think I miss, anything that you want to hear, please comment below. Thank you for my family, my patients are always supporting, and this is for all of us. We need to change the concept of healthcare around the world. If we see that our country that are doing it good, we have to see what they're doing and replicate it and do it better, improve it. It's all about improving. So until the next video, until next week, please share, subscribe, give a like, and all those YouTube things that help the algorithm. And I see you on the next video.